I've heard from a lot of people in response to some of my videos about getting on and off the floor, and a lot of people are responding that they can't do that because they've had a total knee replacement. Some people say it hurts too much to get on their knees, and some of them are under the impression that they are not allowed to be on their knees. So I want to address that second one first. After you've had a knee replacement, the surgeon may say, don't get on your knees, but that's usually a temporary thing. With your initial incision, they want things to heal before you start putting that much pressure on it. But by the time things have healed, 2, 3, 4 months later, you should be allowed to put weight through your knees, at least temporarily, so that you can either kneel in church for a few minutes or be able to get off the floor. But that is definitely something you need to clarify with your surgeon. Many of them will make blanket statements, but not really give you the details of it. So if you've been told that you are not allowed to be on your knees, I would suggest getting clarification. Was that just for the beginning, the healing phase? Do you have a time limit? Is there any other restriction that you need to know about? Okay? Because when you are on the floor, if you have fallen, it's very hard to avoid being on your knees. There are ways, I will grant you that, but they do require more effort and can just be more challenging. So I do truly believe that the physicians would be okay with that temporary movement. It's not going to do any damage. But now let's talk about the other reason, the fact that people have a lot of pain putting weight through their knees after a replacement. Sometimes it's more of a superficial tenderness and sensitivity, more in the skin and the tissue. A lot of nerves have been, I'm not going to say damaged, but upset and aggravated by the surgery, and things just become more sensitive. That's probably one of the more easy things to take care of. When someone's had a knee replacement, I usually recommend starting pretty early with some desensitization. And it's easy to do with just a washcloth or a soft cloth, whatever you have, starting with something extra soft if you are particularly tender, and just rubbing it on the knee. Getting it used to being touched with different things. As that gets easy, if that doesn't feel bad, then you start using more and more coarse materials. Nothing like sandpaper or anything like that, but just something rougher. Burlap is pretty rough, right? So you'll start getting rougher and rougher and get that skin used to it. And then you start adding pressure. Now, if it's more of a deeper pain that you're experiencing, some people are bothered by the button that is sometimes applied to the kneecap to hold it in place. And so sometimes people really just feel that. I have one woman actually who is very sensitive on one knee, but not on the other. And they've both been replaced. So it really does vary a lot between people and between body parts. So if that is a problem, still some desensitization can be helpful. So once you've kind of gotten past the touching, and that's not feeling too bad, then we start applying the pressure. And I suggest doing something very minor, but that you can control. And obviously this will vary depending on the flexibility of your knee, but you can have different heights, maybe where you don't have to bend as much. But just starting to put pressure through your knee where you are in full control. For instance, right now, my leg is resting on the seat, but I'm not really bearing any weight through it, but it feels some pressure. As I can do more, I start leaning into it a little bit, taking some pressure just on and off, seeing how that feels. A great place to do this is actually in your bed. And I like that because not only are you getting contact through your knee, but it's also a great place to practice getting up and down from being lying on your back. You can actually roll over, get onto your hands and knees, just like you would need to do on the floor if you have fallen. So assuming you have a bigger bed, not a twin size, you can practice kind of rolling over. Start with just that initial contact, maybe almost like a half roll. Feel a little pressure through the knee and come off. And then work on getting all the way up onto hands and knees. You know, most beds have those memory foams or something soft that it's not going to be anything like being on the floor. So those are some ways that you can help reduce the sensitivity in the knees and get them accustomed to having weight through them. Now, some people will be able to recover and it won't be a big deal, you know, maybe a little tender, but it's not anything that holds them back. And other people, yeah, it's going to hurt. It's not going to be something you choose to do. But at the same time, I want people to be prepared. If you were to fall, but you have not gotten on the floor and off the floor in years because you had a knee replacement, how are you going to recover? Will you have the strength? Will you have the motor control? Like, does your body know how to get off the floor? Because you can be pretty strong, but if you don't understand how to place and position your body, you may sit there and struggle because you're trying to avoid being on your knees. So I really do recommend practicing every now and then. You don't have to be on your knees long. It can be pretty quick. And I'm going to show you a few ways that you can use to get on and off the floor and ways we can modify it so that you don't have as much contact on your knees in order to help with that. So if you've fallen and you're on the floor, we're just going to go over some ways to do it if you have furniture to pull up on. That's a whole nother video if you don't have furniture. So we're going to go with the most common ways here. So the way most people get up would be getting up and placing one leg up through this half kneeling position and either pulling on the couch or, pushing on the leg and coming up. So if you've only had one knee replaced, you could likely do that technique without ever actually placing your knee down. The operated leg could be your upper leg, and you can push yourself up. Now, I can already hear people saying, but that's the operated leg, it's not going to be strong enough. Well, maybe, but let's get it stronger so that it can. But I also want you to consider that the back leg and the arms are going to be doing a lot too. That back leg, it's not just going to trail behind you, but by tucking my toes under, I'm going to be pushing through onto this front leg, taking some weight through my arms so that my front leg doesn't have to do all the work. Depending upon your strength, your flexibility, you're going to have a little different technique. One leg's going to work more than the other. Your arms may have to do more than to other people. Everybody is different. So this has to be a pretty general description right now. Now, if you can take just a moment of weight, let's say you can get up on your knees just for the moment, but then pop them up. That's another way to get off the floor. Again, you're not having to go far, but let's say you have fallen and you're way over here. Instead of getting on hands and knees and crawling to the couch, you can scoot and get as close as you can so that you avoid being on the knees for any longer than necessary. So then from here, again, I'm going to have to be on my knees for a moment, but I'm going to try to quickly get off my knees so that I can get up. Strength is required through the upper body. Strength is going to be required through the core. But just like with any technique, you do need to be strong, just in different ways depending on the strategy that you use. Now, the technique that absolutely requires no pressure through your knees can be tough for some people. They don't have adequate strength through your hips and core and upper body. This is what that one looks like. So if I'm on my back, kind of sitting upright, I would cross one leg over, take my other arm, cross it over, and as I do that, I use some momentum so that I can lift my hips up. Notice my knees are not on the floor, and come up. Again, I can hear people already saying to the screen, my knees won't bend that much. You change it a little bit, right? So I had my knees bent up pretty far because I can. If you can't, you have them straightened out a little bit. I have them straighter. I have them straighter. There's always going to be something that's difficult in the technique. There's always going to be someone who says, but my knees won't do that, my hips won't do that. You know what? That's what therapy is all about. If you do not have a method to get on and off the floor, whether it be because you have painful knees, your hips, your shoulders, whatever your limitations are, that's where a therapist can help you figure out the best strategy for you and figure out what exercises, what activities that you can do to make it easier. We do not expect, we as therapists do not expect that you will be able to just see a video and, oh, okay, I know how to do this. That is not my intention at all. I am here to give you some ideas, but then more than anything, it's to get you starting to think, okay, this is my limitation. Now I need to figure out how to work around that. What are my strengths? Where am I stronger that I could actually use? And oh, let me find a therapist to help me with this process. I know that a lot of physical therapists, when a client goes in and talks about falls, many therapists will focus more on the prevention part. They'll get you doing some exercises, some balance training. Many will not actually work on the getting down and back up. So make sure that the therapist you reach out to does that, because that is crucial. I could have a person doing leg presses and wall push-ups and all these different exercises for strength and flexibility, but if you don't actually do the action that you're working toward, the chances that you're going to improve that are much less. Just like any kind of skill that you're learning, if I were learning how to play the piano, I'm not going to just do finger exercises, with a weight or a putty ball and expect that I can play the piano, right? It's the whole sequencing and the motor planning and how do I position my body and move my body. There's a lot more to it than just being strong and flexible. So if you get anything out of this little talk here, it is to please reach out for help so that you can feel comfortable, maybe not physically, but at least cognitively, mentally, emotionally comfortable getting on and off the floor in the event that you were to fall and need to get up. And bonus, maybe it would also allow you to do other things that you haven't been able to do. Maybe getting down to play with your pets or your grandchildren, or doing some gardening, or simply doing something on the floor in your home, picking things up, grabbing that remote under the couch that fell, whatever the case may be. Being able to get on and off the floor is a great skill. So I hope it is something that you can conquer. I hope that helps, and I'll see you next time.